Coming up on Medwatch today, meet a woman who's glad she paid attention to her body's warning signs, how a self-breast exam saved her life, and what women should look out for in taking care of their own health. That's just ahead. And living life to the fullest after bariatric surgery, how Fresno Heart and Surgical Hospital's Bariatric Patient Support Group helps patients navigate life after surgery, making sure they stay healthy and happy. That's coming up. And did you know that in our country, more than 90,000 people receive emergency room treatment from ladder-related injuries every year? We hear from a safety expert on what to remember if you climb up that ladder to decorate for the holidays. That's just ahead on Medwatch today. Hi there, and thanks so much for joining us. I'm your host, Stephanie Bainum. It's rare to meet a family these days who hasn't been somehow affected by cancer. According to the American Cancer Society, nearly 2 million people will be newly diagnosed with cancer this year. Cancer does not discriminate and can strike at any time. We talked to one local woman about her breast cancer journey and how staying positive and doing a self-breast exam helped to save her life.
Okay, there's dinner, guys. Thank you.
One memory stays fresh in the mind of Laura Lopez.
When I was in the shower, I started doing my self-breast exam. And when I was examining myself, I noticed there was something, a lump that I had not noticed before.
Laura headed to the doctor and received news that no one wants to hear.
It's a tumor. And I looked at him and I said, okay. And you know, it didn't hit me. I was hoping it would go away, and I kept thinking that it's just a bad dream and it's just gonna go away.
But it wasn't a dream. It was breast cancer. And when reality did set in, Laura says she immediately thought about her 3 kids.
I just remember I just started crying, and I thought, I'm gonna be okay. It's just a tumor, and they're just gonna come in and they're gonna remove it, and I'm gonna be okay.
And Laura was determined to stay positive as she headed to the Marjorie E. Radin Breast Care Center at Clovis Community Medical Center to start her treatment. One of Laura's doctors is the medical director of Community Medical Center's cancer program, Dr. Chris Perkins, who says the care you get at Community is unlike anywhere else.
Having that community of people, all the support staff, physicians, and the infrastructure and technology all blended together to take care of the community.
Dr. Perkins specializes in cancer in women and says Laura is a good example for women by doing that self-breast exam that very well saved her life.
You know, unfortunately with women, they put themselves last. You know, it's the family, the kids, the husband, the parents, work, and then finally women will slide in just a little bit of time to get their mammograms, usually late, you know, getting their pap smears, not on a timely manner. So I think it really is a call that women need to kind of move up the list of their priorities.
And even though Laura is still finishing up her chemotherapy and radiation, things are looking up, as Laura considers herself one of the fortunate ones.
I'm very lucky, very, very lucky. I have the 3 best kids ever, and there are people there that you have to live for.
Choosing to celebrate life over a diagnosis and coming out stronger on the other side. With the cold weather upon us, doctors are seeing more cases of croup in kids. Croup is an upper respiratory infection that affects breathing and has a distinct barking cough like a seal. We talked with Dr. Erica Gastelum about the virus and what parents need to know. Dr. Gastelum, thanks so much for joining us today.
My pleasure.
So we're talking about croup and whooping cough. Some folks confuse the two, and it's a really bad season, you say, for croup. Tell folks the difference.
So croup is a little bit more like a barking cough. So your child genuinely sounds like a seal or a dog. So if you hear that kind of cough coming out of your kid, definitely be a little bit more worried. The whooping cough is more like a staccato cough, so like little short bursts of coughs. And whooping cough is also known to be associated with vomiting after the cough. So sometimes kids can vomit after they have that repeated cough.
And so what are some symptoms that parents should look out for where they might notice this isn't just a cough or cold?
So aside from the barking cough that makes them sound like a seal or a dog, they definitely want to look for the breathing pattern of the kid. So if their child is breathing a lot faster than they normally do, or if they're sucking in their belly when they're breathing, or if they notice when they're looking at their kid that the skin between the ribs is sort of sucking in a little bit more, then that's really, really worrisome. They should take the kid to the doctor or the emergency room right away.
That's some great information that parents will really appreciate. So thanks so much for your time and your expertise. We appreciate it. Coming up on Medwatch today, hear the inspiring story about a woman who became a nurse after seeing the way her own dad was treated as a patient at Community Regional Medical Center. Why she says it's never too late to change your career path and make a difference in your community. We meet our healthcare hero next.